Chapter 22. The Heart and Circulation 1. Shortness of breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs. But in severe cases, it may be present even at rest. A patient who is breathless when lying flat ortho, orthopnea, for example, in bed, will tend to sleep raised up on two or more pillows. The abbreviation SOVO stands for shortness of breath on exercise or on exertion or effort. Patient patient say, I get terribly short of breath climbing stairs. Doctor can ask, how many pillows do you sleep on? Part B. Heart rate. The normal resting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 per minute. The heart rate may be regular or irregular. In an irregular rate arrhythmia, there may be early beats which interrupt the regular rate. Premature beats or the rate may vary with respiration, or it may be completely irregular as in fibrillation. When patients are aware of irregularity, they describe the symptoms as palpitations. Case 4. A 20, a 22 years old student was admitted to hospital with a long history of heart problems. She had been increasingly tired with shortness of breath on exertion orthopnea and palpitations. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms of heart failure, but was followed by episodes of atrial fibrillation, which had been particularly severe for the 6 months before admission. Part C. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output. The amount of blood pumped by the heart each minute for the body's needs. This may involve the left side of the heart, the right side of bones. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema, swelling, beginning in the feet and ankles. This is known as pitting edema if, when a finger is pushed into the swelling, causes a small depression or pit. Aorta, pulmonary artery, pulmonary veins, tricuspid valve, mitral valve, and septum. Complete the conversation based on the case history in the opposite. Doctor, what seems to be the problem? Patient, I've been getting palpitations. Doctor, how long have you had them? Patient, for about 6 months. But I have heart problem for years with tiredness and shortness of breath. And I couldn't walk. more, more than 100 meters without having to stop. I had to sleep on 3 pillows. I had a mitral valve replacement 3 years ago. That improved things for a while. Make word combination using a word from each box. Two words can be used twice. Look at B and C opposite to help you. At at rest. Atrial fibrillation. Cardiac output. Heart failure. On effort. Peering edema. Premature deaths. Write the words a patient would use to describe the symptoms below. Look at A, B, and C opposite to help you. 1. Dyspnea. Breathlessness. Arrhythmia. Palpitations. Orthopnea. Breathlessness when lying flat. Edema. Swelling. Complete the case report. Look at A, B, and C opposite to help you. Case 30. Case 13. At 60 years old, a woman attending her GP's surgery complaining of breathlessness on exercise. This had been increasing over the previous 8 months until it was producing problems at around 500 meters, walking on the level. There was no history of chest pain. She had had several attacks on fast palpitations, which lasted 20 to 30 minutes and were associated with some shortness of breath. She had noticed some swelling of her ankles by the end of the day. This disappeared overnight. Over over to you. How would manage the treatment of the human in 22.4 Avo? I would give her medicine for heart failure and advise rest. Now, in Spanish. El corazón y la circulación. 1. Dificultad para respirar. La dificultad para respirar o falta de aire es disnea. A principio, esto se debe al esfuerzo físico, actividad como subir escaleras, pero en casos graves puede presentarse incluso en reposo. Un paciente que tiene dificultad para respirar cuando está acostado, ortopnia, por ejemplo, en la cama, tenderá a dormir incorporado con 2 o más almohadas. La abreviatura COVOE significa dificultad para respirar durante el ejercicio o durante el esfuerzo. Los pacientes dicen, me falta muchísimo aire al subir las escaleras. Los médicos pueden preguntar, ¿con cuántas almohadas duerme? El ritmo cardíaco. La frecuencia cardíaca normal en reposo es de 65 a 75 latidos por minuto. En los atletas puede ser tan baja como 40 latidos por minuto. En la actividad atlética extrema, la frecuencia cardíaca puede llegar a ser tan alta como 200 latidos por minuto. El ritmo cardíaco puede ser regular o irregular. En un ritmo irregular, arritmia, puede haber latidos tempranos que interrumpen el ritmo regular, latidos prematuros, o el ritmo puede variar con la respiración, o puede ser completamente irregular, como en la fibrilación. Cuando los pacientes son conscientes de la irregularidad, describen el síntoma como palpitaciones. Caso 4. Un estudiante de 22 años ingresó en el hospital con un largo historial de problemas cardíacos. Había estado cada vez más cansada, con dificultad para respirar, hacer esfuerzo, ortopnia y palpitaciones. Se le había realizado un reemplazo de la válvula mitral 3 años antes y esto había estabilizado los síntomas de insuficiencia cardíaca, pero fue seguido por episodios, ataques de fibrilación auricular, que habían sido particularmente graves durante los 6 meses anteriores al ingreso. Insuficiencia cardíaca. La insuficiencia cardíaca se produce cuando el corazón no puede mantener un gasto cardíaco suficiente, es decir, la cantidad de sangre que bombea el corazón cada minuto para las necesidades del cuerpo puede afectar al lado izquierdo del corazón, al lado derecho o ambos. En la insuficiencia cardíaca izquierda, el síntoma principal es la dificultad para respirar. Los síntomas de la insuficiencia cardíaca derecha incluyen edema periférico, hinchazón, que comienza en los pies y los tobillos. Esto se conoce como edema con fovea. Si al presionar con un dedo la hinchazón se produce una pequeña depresión o hoyo. Aorta, válvula tricúspide, arteria pulmonar, venas pulmonares, válvula mitral, tabique. Thank you.